space maintainers. In the quest of providing optimum oral health care, there's an age-old maxim that prevention is always better than cure. Now, orthodontics can be divided into preventive, interceptive, and corrective orthodontics. Now, what is preventive orthodontics? Preventive orthodontics, they incorporate the measures which are taken to preserve the integrity of the arch at a particular point of time or a specific point of time. For example, we use space maintainers in preventive orthodontics. Now, what is interceptive orthodontics? Interceptive orthodontics, these are the measures which are taken to preserve and to prevent a malocclusion from developing into a more severe one. Today, we'll get to know more about the preventive orthodontics, that is, the space maintainers in the use in preventive orthodontics, where we'll be discussing about the various type of space maintainers, the ideal requisites for the space maintainers, the classifications, and the various type of appliances. Now, how can the space maintainer be defined? A space maintainer is a device or an appliance which is used to maintain the space which is created by the premature loss or the premature exfoliation of a primary teeth, so as to preserve or to guide the unerupted permanent teeth in a proper position in the dental arch. For example, if there is a premature exfoliation of the first primary molar, and after the exfoliation is there, we place a space maintainer to preserve the space which is created. Now, the space maintainer preserves that particular space till the permanent successor erupts in that space. Now, what are the objectives of giving a space maintainer, or why at all a space maintainer should be given? First of all, the main aim of a space maintainer is to preserve or maintain ideal space which is required for the eruption of the permanent successor. Then, to preserve the primate spaces or the physiological spaces which are already existing in the arch. For example, the space which is present between the lateral incisor and the canine in the maxillary arch, whereas the canine and the first molar in the mandibular arch, because these spaces are further utilized by the permanent teeth to erupt in proper position. So, the space maintainer preserves the normal physiological spaces which are present in the dental arches of a primary dentition. Moreover, a space maintainer also maintains the integrity of the dental arches. It prevents the collapsion of the arches and prevents the proper perimeter of a particular arch. The space maintainer also preserves the normal occlusal planes of the mandibular as well as the maxillary arches. And in the case of anterior space maintainers, they help in maintaining the proper aesthetic, the labial fullness, and the proper phonetics of a child. In the case of posterior space maintainers, they can also act and help in proper mastication and deglutition. Now let us see where at all we require a space maintainer. That is, what are the indications of a space maintainer? A space maintainer is used whenever a primary tooth is prematurely exfoliated, or if there is the delayed eruption of a permanent tooth. If a primary tooth is exfoliated before the normal time, we can place a space maintainer appliance in place of that tooth till the permanent successor erupts. For example, if there is a premature loss of the primary first molar, we can use a band-in-loop appliance in the space of that molar to preserve the space and wait till the permanent or till the premolar erupts in the arch. Now, if at all the time which is present between the eruption of the permanent successor is between 6 months to 2 years, we can use the space maintainer in the space which is present. It is also indicated in the case of supra-eruption of the teeth. For example, if there is a tooth loss from a particular space, the opposing tooth will supra-erupt in that space. So, in order to preserve that space, we use a space maintainer. A space maintainer also restores the normal masticatory system or the mastication apparatus of the primary tooth. It helps the child to maintain normal physiological masticatory process, and it is also responsible for maintaining proper dental health of the oral tissues as well. Space maintainers are also indicated in the cases where in giving a space maintainer will further less complicate the orthodontic treatment for a particular person. It can also be given in patients where all orthodontic treatment is not required in future stages of life. Now let us see what are the contraindications or what are the conditions in which we cannot give the space maintainers at all. In the case when the space which is present by the exfoliation of the primary teeth will show no signs of closing, or the space which is available for the permanent teeth to erupt will be greater than the mesiodistal width of the permanent teeth which will erupt in that space or the permanent successor. So, if the space shows no signs of closing and the space which is available is greater than the space which is required for the eruption of the permanent teeth, we do not give a space maintainer in such conditions. In the case when the permanent successor is absent or there is anodontia, in such cases we do not give a space maintainer. In the case where orthodontic treatment is mandatory or there is the developing malocclusion, in the case where serial extraction is indicated, we do not give a space maintainer. Now, if the radiograph of the tooth will show the calcification of the root of the permanent successor is almost 1/3, or if the permanent successor is about to erupt in the oral cavity, in such conditions also space maintainer is contraindicated. Now coming over to the ideal requirements or what are the requisites for a space maintainer appliance. First of all, a space maintainer should preserve the space which is required for eruption of the permanent successor. Next, it should also guide the permanent successor to be in place or to erupt the permanent successor in place. Furthermore, it should prevent the supra-eruption of the opposing teeth or the opposite teeth of the arch to erupt in the space which is created by the early loss of the primary teeth. Then also, a space maintainer should be strong and robust enough to withstand the masticatory forces and the forces of occlusion of a primary dentition. It should be simple in construction and it should not take a lot of time in construction. It should be biocompatible, that is, it should be corrosion resistant in the oral cavity by the action of oral fluids and the saliva. It should also not cause any undesirable forces on the teeth surfaces, which will further lead to tipping of the teeth, decalcification, or movement of the teeth, or even loosening of the teeth and deteriorate the periodontal health of the teeth. So, the space maintainer should be strong enough, and also the space maintainer should not exert any unwanted forces on the dentition. It can also help in mastication, normal physiological process of deglutition. It should be reasonably strong, and a person should be able to maintain the oral hygiene properly with the space maintainer in mouth. It should be durable enough, that is, a space maintainer should not break on very easily. Now, let us see what are the factors which are required for selecting of a space maintainer. That is, how can we select that this particular space maintainer should be used for this patient? There are certain factors which are considered for the same, which can be enumerated as patient cooperation, integrity of the appliance, then maintenance of the appliance, modifiability, the time limit and other limitations. Now let us go into the details of each. Now, in the case of very uncooperative patients, we cannot give a removable type of space maintainer. And in patients where there is a high caries incidence, we cannot give a fixed type of space maintainer because a fixed space maintainer can lead to decalcification, and the maintenance of oral hygiene cannot be so proper. So, in an uncooperative patient, removable appliance is not preferred. Fixed appliance is preferred in place of the removable appliance. Now, how will the integrity of the appliance affect? The integrity of the appliance should be checked from time to time by a pedodontist or the dentist who has applied the space maintainer in the arch, because it is more prone to breakage. Then, the frequency of breakage of that particular appliance should also be considered. Next, the space maintainers should be maintained properly in the dental arches, because if we use bands in the fixed space maintainers, the cement which will be bonded to the bands will tend to lose with time or tend to dissolve in the oral fluids. So bonding of the cement to the maintainer as well as the tooth is necessary, and proper rechecking of the bond should be there so that to avoid any inadequate slippage and breakage of the space maintainer in place. Next, the modifiability of the space maintainer should also be considered so as it should not affect any erupting teeth from eruption in the dental arch. Furthermore, for example, there are certain space maintainers like band and loop, the lingual arch, which can be given U-loops for modification in the arm, for adjustment of the arms. So the space maintainers should be such that they can be modified easily for the requirements of the patient. In order to match with those requirements, we use to modify the space maintainer. Now, there's a certain time limit for which a space maintainer can be given. That particular time limit should be considered. For example, few space maintainers require a period of 6 months to 1 year, or few may even require 2 to 3 years to be in place. So, this time limit should be considered or kept in mind before placing the space maintainer in the arch of the patient. Now, there are also other factors like the amount of the bone which is covering the tooth. For every 1 millimeter of bone, it will resorb in a period of 6 months. So the amount of bone which is covering should be considered. Next, the eruption sequence of the tooth. The molars will erupt after the canines, the second molars. So all these factors should be considered before placing a space maintainer. Furthermore, the dental age of the patient should be considered. Now, what is the dental age? The dental age is the age which coincides with the last erupted tooth in the oral cavity. This also should be kept in mind. Furthermore, the direction of closure of spaces. In the maxillary arch, the direction of closure is distal to the extracted or the space present, and in mandibular arch it is mesial. Furthermore, the canines they migrate distally and the molars they tip mesially. These are the factors which should also be kept in mind before placing a space maintainer. Now, what is the rate of space closure? The rate of space closure in maxilla is greater than that of the mandible. And in the first 6 months, the rate of space closure is maximum and it is more in the first 72 hours. So, as soon as this tooth is extracted or there is an exfoliation of the tooth from the oral cavity, a space maintainer ideally should be constructed, fabricated and placed in the oral cavity because the rate of space closure is maximum in the first 6 months. Now there are other factors like the available space. For example, if the space available for the eruption of the permanent successor is greater than that of the space which is required, then a space maintainer can be given. The curve of Spe. For every 1 mm of the curve of Spe, 1 mm of the space is gained. There are other miscellaneous factors, for example, proximal space loss, proximal caries, and the wear and tear of teeth. These are the particular factors which should be considered or kept in mind by a dentist before fabrication, selection, and placing of the space maintainer in oral cavity of a patient with premature exfoliation. Now let us see what is a particular classification of the space maintainer. The classification of space maintainers according to Hitchcock can be divided into active or passive. The active appliance, for example, lingual arch, and passive is the distal shoe space maintainer. With bands or without bands. With bands are the space maintainers which are cemented in the oral cavity by the means of stainless steel bands. For example, band and loop space maintainer, distal shoe space maintainer. Then without bands are the removable type of space maintainers. Now the fixed or removable space maintainer. Then also the fixed space maintainers are cemented to the oral cavity by the means of those stainless steel bands which are kept in place. Now they can be unilateral or bilateral, for example transpalatal arch and non-palatal arch, and they can be also the combination of above. So it can be summed up as active or passive. Active appliances are which exert the forces on the tooth surfaces, and passive are which are there in the tooth surfaces contact but they do not exert any force on the tooth surface or cause movement of the tooth. These are the passive appliances, for example band and loop space maintainer. Then active or passive, with bands or without bands, fixed or removable, unilateral or bilateral, or the combination of all of the above. Then another classification was given by Hinrichsen. He classified the space maintainers into two broad categories, that is fixed type of space maintainers and the second was removable type of space maintainers. In fixed type of space maintainer, which was further divided into class 1 and class 2. The class 1 type of space maintainers can be further categorized into functional and non-functional. in which the functional include pontic or lingual arch type of appliance, and the non-functional include band and loop or the bar and loop type of appliances. Next, coming over to the cantilever type of appliances which act as a lever. They can be either band and loop and the distal shoe type of space maintainer. Next is the removable space maintainers. They incorporate acrylic partial denture. They can be functional or non-functional. The various type of space maintainers which can be used by the premature exfoliation of primary teeth are band and loop type of space maintainer, the lingual arch, the transpalatal arch, the NANCE palatal arch, the distal shoe type of space maintainer, then the fixed and removable type of space maintainer. These are the space maintainers which are used frequently in the dental clinics by the pedodontists. Now coming over to the elaborate form of band and loop type of space maintainer. It is a fixed, passive appliance which is unilateral in nature and a passive type of appliances. These do not exert any force on the tooth surfaces and do not cause the movement of the tooth. They are fixed to the tooth by the means of band and the luting cement. They can be either unilateral, that is, they can be used only on one side of a dental arch, or they can be used in a bilateral manner, that is, they can be used on both the sides of the dental arch. It is one of the most commonest type of space maintainer which is used in dental clinics. Here in the figure we can see there is a premature exfoliation of primary second molar and a band is adapted on the permanent first molar and a loop is constructed by soldering to the band which is further attached to that of the primary second molar. Now what are the indications of the band and loop type of space maintainer? This is usually indicated when there is a premature exfoliation of the first primary molar in the dental arch. Usually it is indicated in unilateral loss of teeth but can also be used if the molars are lost bilaterally. Then they can also be used in the loss of primary second molar, but in such conditions a reverse band and loop is used. They can also be used in the case of premature loss of the primary canine. Here the primary first molar is banded and the loop is constructed which is further attached to that of the distal surface of the lateral incisor. It can be also used in the bilateral loss of primary molars before the eruption of the permanent incisors, because after the eruption of permanent incisors, a lingual arch holding appliance is used as a space maintainer. Now, what is the advantage? What is the particular advantage of a band and loop space maintainer over other types of space maintainers? First of all, it is very easy to construct. It is less time taking. It requires less appointments of the patient. So, it will further enhance the patient cooperation. It can be modifiable in various forms. For example, a band and loop can be converted into a reverse band and loop appliance, a saddle type of appliance, or appliance with stoppers, etc. Furthermore, it is an appliance which requires a very fewer appointments for delivering to the patient, and it is easy to construct also. There are certain disadvantages which are related to the particular appliance, that is, it can cause decalcification of the molars because of the bands which are used in the appliance, which will lead to the corrosion of the tooth surface. It can also cause the supra-eruption of the erupting opposing permanent teeth, in the space, it does not restores the function of the normal masticatory system. Furthermore, it is also subjected to slippage of the band, that is, the arm of the band and loop, or the loop also can easily slip down to the gingival level. It can also not be used in the case of multiple loss of primary teeth. An appliance named as long band and loop was used in the case but was not much successful. There are certain modifications of this particular appliance which can be crown and loop. For example, if the first primary molar is pulpectomized, or it is hypocalcified, or it is destructed, we can construct a crown, stainless steel crown on that molar, and further we can solder the loop to the crown, and further construct the band and loop in the oral cavity. They can also be bonded band and loop type of space maintainer, in which the loop is directly bonded to the primary teeth which is present by the means of composite resin. Here, we do not require any bands. So this will also protect the tooth from hypocalcification or corrosion. Then reverse band and loop is another type of appliance which can be used in the premature exfoliation of second primary molar, where the band is present or band is calcified in the first primary molar and the loop is subjected and it rests on the dismesal surface of the first permanent molar. The bands can also be used with stoppers. The stoppers prevent the band from slipping gingivally. So these were certain modifications of band and loop type of appliance. Also, recently another appliance which is reported is a saddle type of appliance which can be used in the premature loss of the second primary molar. Here, the loop is shaped in the form of a saddle to prevent supraeruption of the teeth and protect it from slipping and undue masticatory forces. This is also another loop is there in which the loop is halved. This type of appliance is known as mayonnaise appliance. Now progressing further to the crown and loop type of appliance. This is an appliance in which a stainless steel crown is soldered to the loop. Now coming over to the lingual arch type of appliance. It is also known as lingual holding arch. It is a classical type of appliance which is used in the mandibular arch. Here it consists of two bands. The two bands are cemented to the first permanent molars of the oral cavity or the mandibular arch. The two bands can also be cemented to the second deciduous molars, whichever are present or whichever the last teeth is present in the oral cavity. Now, after cementing these bands, a loop is soldered or a wire is soldered to this band so that it covers the perimeter of the arch and towards the cingulum of the permanent mandibular incisors. It will butt against the four mandibular incisors which are present in the oral cavity. It is a fixed type of appliance which can be functional in nature and is an appliance which can either be active or passive. It is a bilateral appliance, that is, which can be used in the case of multiple loss or bilateral loss of multiple teeth. Now, what are the advantages of the same appliance? It preserves the arch form or the integrity of the dental arch. It can also be used in the multiple loss of primary teeth in the dental arch. It is maintaining the perimeter of the arches, particularly the mandibular arch in the case of premature loss of multiple teeth. It also prevents the tooth or the molars from drifting measly or tipping measly in the dental arch. because it will hold up the molars by the means of band and the soldered wire which is present. All these forces will prevent the molars from tipping. The lingual arch type of appliance will promote the eruption of the permanent teeth in the oral cavity. It will not prevent the eruption of the succedinous teeth. It cannot be easily displaced that it is very stable in the dental arches due to the two bonded bands on the molar teeth. A person or a patient can easily maintain their oral hygiene with lingual arch in position, so it is easy to clean. There are many modifications which are possible. For example, Holt's type of lingual arch by the means of loops, which can help in adjusting the lingual arch in the oral cavity. It also provides superior patient's comfort. The comfort level of patient with this lingual arch type of appliance is superior to other appliances in the mouth. It will not cause any undue forces on the teeth and also prevent any supra-eruption of the permanent teeth in the spaces which are present. But there are also certain disadvantages which are linked to the lingual arch type of appliance. It can also cause sometimes the extrusion of the teeth. The teeth can be hypocalcified because of the bands which are present. They may lead to decalcification of the tooth surface. In the patients which are high prone to caries or the caries index in the patients is high, we cannot give a lingual arch. It can also promote the decay of teeth in such type of patient. It can also not be given in non-compliant type of patients. Now, what are the indications of this lingual arch type of appliance? It can be given when the premature loss of primary molars bilaterally or unilaterally, or in the multiple loss of the primary molars. It can also help in restoring the aesthetic functions of the dental arch. We can use acrylic anterior teeth if they are absent to restore the aesthetics. It can also be used as a habit breaking appliance in the case of tongue thrusting. This is a picture of a lingual arch. Here we can see the bands are incorporated in the permanent first molars. They are bonded by the means of eluting cement, and a loop or arms are created along the extracted space, touching the cingulum of the permanent mandibular anterior teeth. This will also maintain the arch perimeter. A lingual arch can also be modified by giving U-loops in the extracted space, which will help in further adjustment of the arms which are present. Now coming over to the NANCE palatal arch. NANCE palatal arch basically is a bilateral type of appliance which can be used in the multiple loss of bilateral teeth. It is a non-functional appliance that does not cause any tooth to move in the oral cavity. It is a passive appliance. It will not restore the masticatory function, and it is used in the maxillary arch. Basically, it is a fixed type of appliance which is fixed to the arches by the means of bands. The NANCE palatal arch do not contact with any anterior teeth, but in place, a button or an acrylic button is used in this type of appliance which will contact with the palate or the palatal rugae. The major indications of this type of appliance is in maintaining the arch perimeter of the maxillary arch. If the first permanent molar is in position and when there is the bilateral loss of the primary teeth in the maxillary arch. It can also be combined with a habit-breaking appliance in the case of the thumb sucking. Another appliance which is used is a bluegrass appliance, which is used in the cases of chronic thumb sucking. It is an appliance which can also be used as an arch stabilization agent. So this is a particular advantage of this type of appliance. The basic disadvantages are that the tissue button or the acrylic button, due to the trauma of the tissues of the palatal rugae, it can cause tissue hyperplasia or irritation to the palatal rugae or the palatal tissues. If in the cases where the patient is allergic to this acrylic, in such cases it is contraindicated and it cannot be given. So this is a particular disadvantage of this type of appliance. Moving over to another appliance, which is the transpalatal arch. Transpalatal arch is a unilateral type of appliance. That is, it can be used in the premature loss of unilateral teeth on one side of the arch. It is a non-functional appliance which is fixed in nature, that is fixed by the means of bands, and is a passive appliance which will not cause movement of any of the teeth in the dental arch. It is used basically in the maxillary arch, in the premature exfoliation of primary teeth. The basic recommendations for the same appliance is in the maxillary arch when the first permanent molars are present and the primary molars require extraction or are prematurely exfoliated. The indications of the same appliance is when one side of the arch is intact and on the other side there is multiple loss of the primary teeth, or there are multiple teeth which are missing on other side of the arch, basically the maxillary arch. When second is the case when the primary teeth are lost bilaterally, but very rarely in such conditions this type of appliance is used. The appliance can also be designed in order to prevent the molar rotation. It can also be used in the case of arch expansion. The basic advantages of the same appliance is it can be either used in multiple loss of unilateral teeth. It can also be used in the case of arch expansion. And now how this is possible? By means of expanding the U-loop which is constructed in the arm of this transpalatal arch. The basic disadvantages that it may cause slight rotation of the permanent molars due to the bands and the forces which act. If the forces are imbalanced, it may cause tipping of the molars, and both the molars may tip together and may also cause the collapse of the maxillary arch. Next, coming to the one of the most complicated appliance, which is the distal shoe or the intraalveolar appliance. It was first reported by Roche. Now Roche gave a gold casting type of appliance, which was further modified into an appliance which was made of cast iron. The distal shoe is basically an intra-alveolar appliance. That is, it consists of an arm which will go gingivally into the arch, which will guide the eruption of the first permanent molar in the oral cavity. Here, the abutment tooth or the tooth for support is the first primary molar. It can be used in the cases where there is a premature exfoliation of the second primary molar, but it is used before the eruption of the first permanent molar, so as to guide the first permanent molar in the oral cavity. Here we can see that a crown is placed on the first primary molar and an arm or a band is placed, then an arm which is soldered to this first primary molar, which has another arm which extends gingivally to guide the eruption of the first permanent molar in the oral cavity. The indications of the appliance are when there is premature loss of the second deciduous molar, prior to the eruption of the first permanent molar, as I have already told. It is also used in the case of ectopic eruption of the first permanent molar. So this type of distal shoe appliance is also known as Willett's appliance or Willett's distal shoe because the construction of the appliance was given by Willett. The indications we have already discussed. Now there are certain contraindications for the same appliance. It is contraindicated in the case of the patients who are hemophilic or the patients having congenital heart disease or some other medically compromised patients. Next, in the case where the permanent successor or the permanent first molar is absent. So there is no question of guiding the particular molar into the oral cavity if it is absent. In the case where the patient is not cooperative at all and the parent is not agreeing to the treatment, when the patients are having a poor oral hygiene, where it is suspected that the socket which is created by extraction will not heal properly. Then, if the abutment tooth or the first primary molar is also not present, when it is inadequate due to multiple loss of the primary teeth in the oral cavity, in such cases, we do not use a distal shoe appliance in the arch. Now the question arises, what should be the length of the arch or length of the bar which is used in the distal shoe type of appliance? The length of the bar should coincide with the space which is available between the distal surface of the first primary molar and that of the permanent successor which is present in the jaws. We can measure it radiographically. And the length of the arm which is extending gingivally should be up to the mesial marginal ridge of the permanent molar, or it should contact the mesial marginal ridge of the first permanent molar, which can be confirmed radiographically as soon as the appliance is placed in the oral cavity after fabrication. But there are certain disadvantages which are linked to the appliance. The appliance can cause the deflection of the permanent tooth bud because of the arm which is resting on the tooth bud of the permanent first molar. The appliance can also interfere with the epithelialization of the socket and prevent the healing of the socket. It can also cause infection in the socket and the injury of the socket which is created because of the extracted teeth. It is one of the most difficult appliance to construct, and even the retention of the appliance in oral cavity and maintenance by the patient is difficult. So these were the particular disadvantages which were linked to the appliance. This type of appliance can also be modified in various ways, which can be either saddle type of appliance. This appliance can also be incorporated with the lingual arch type. Then a loop can also be constructed in the place of the arm which is going deep gingivally to prevent any epithelialization loss of the socket. So these were certain modifications of this arch type of appliance or intraalveolar appliance. Now coming over to the removable type of space maintainers. These are the particular type of space maintainers which can be removed and reinserted in the oral cavity whenever required by the patient. The maintenance of oral hygiene is also proper in the case of removable type of space maintainers, but it all depends on the cooperation of the patient. There are certain contraindications for the same when the patient is highly uncooperative or not agreeing to wear the appliance in the oral cavity, or if the parents of the patients are not agreeing due to anesthetic reasons. If the child has not attained the mental age of 2.5 years of age, then the child will be unable to understand the importance of the removable appliance and will not wear the appliance at all. If at all, the patient is allergic to the acrylic or If the possibility of caries activity is high in the patient, then this removable appliance is also contraindicated in epileptic patients because they may swallow the appliance or they may break the appliance frequently. They may not wear it at all. The indications of the appliance may be for some aesthetic reasons. When the child has reached a psychological level of greater than 2.5 years of age, when there's a multiple loss of primary teeth or the place where fixed appliance is not possible, in the case where there's supra-eruption of the permanent teeth and a non-functional type of space maintainer is required. In the case of loss of anterior teeth, where aesthetic is a reason which is considered for placing a space maintainer. There are particular advantages of this removable type of space maintainer that it is easy to clean and maintain. It will always retain the vertical dimensions and prevent the supra-eruption of the permanent teeth. It can also help in speech, mastication, aesthetics and deglutition. And it is very easy for the dentist to use post-insertion type of checkups, and further recall visits are easier for the dentists as well as the patients. Now the disadvantages are that these appliances can be easily lost or broken by the patient. For example, if it falls off from the somewhere, it can easily be broken. The frequency of breakage of this appliance is very high. It can be lost by the patient. It will not be worn continuously by an uncooperative patient, so the purpose cannot be solved. It can also interfere with the lateral jaw growth and further growth of the developing arches. It can also cause allergy or irritation to the oral tissues, further leading to tissue hyperplasia. So finally, I would like to conclude by saying that guidance of eruption and development of primary and permanent dentition is an integral part of pediatric dentistry and needs to be taken care of in a proper manner. Thank you.